Okay, we have my client here again, Josiah. He's an 11-year-old African-American male. I'm about to do an abdominal exam on him. I am inspecting for symmetry and the rise and fall with every respiration. I'm looking for scars or any lesions. If he had been in any accidents, I would have asked that to before I palpate the spleen for possible splenomegaly, or if there was any illnesses in the family, to palpate for a possible hepatomegaly. So right now I'm looking at him take breaths, breathe, so I can look at the rise and fall of the stomach. I'm looking at the symmetry. I'm looking for any lesions. Okay, now I'm going to auscultate all 4 quadrants, starting with the right lower quadrant, listening for vowel sounds. I would listen for a full 60 seconds for any hyperactivity. Obviously, if Josiah has recently eaten. Okay, there was no irregular sounds or hyper resonance in the vowel sounds. I would listen for a full 60 seconds, like I said. Now I'm going to listen to the vascular sounds with the bell of the stethoscope. I'm listening for the aorta. Renal, iliac, femoral, and then I would follow that up to the other on the other side. Okay, that all sounds good. Listen for any bruits with the vascular sounds. Now I'm going to percuss. I will percuss the liver, checking for size of the liver. I will start at on the right side at the umbilicus, working up mid-clavicular. And I'm checking for tympany to dullness. Tympany is over fluid-filled spaces. Dullness would mean that I've reached a bone or the liver. I'm checking mid-clavicular because he's such a small person. Okay. And then I would percuss downward from the fourth intercostal space. Once I'd find the span, I would mark that and mark the size of the liver span. If the liver is measured to be bigger, then it could be a possible hepatomegaly due to hepatitis or a possible accident. Now I will palpate by placing my left hand under the right side of the client and pressing up, having him take a deep breath as I press down with my, placing my left hand, having him take a deep breath as I press down with my right to palpate. Deep breath. You can make. Okay. Now also while I'm palpating, I will palpate for the spleen, crossing over the patient, placing my left hand under the left side and pressing upward. Deep breath. If the spleen would be 3 to 5 times bigger than normal, it could be due to mono or a motor vehicle accident where the seatbelt would have caught him, but I don't expect that to have happened in my 11-year-old. I also need to percuss for the spleen. So I need you to take deep breaths. I'm also going to check for femoral pulses, and by having the patient flex the right knee and externally rotate. Just flex the knee, flex your knee, rotate. And I would feel for the femoral pulses. I would also inspect for the inguinal lymph nodes near the same area. I'm also going to inspect for referred pain, where I would press down on the abdomen and ask the patient if there's any pain or tenderness. Any pain or tenderness? Okay. Also for the Murphy's test, that is checking for pain in the gallbladder, and which is near the liver. I would press while the patient inhales. Take a deep breath. If the patient was unable to finish that breath, it would be due to inflammation of the gallbladder, and that's called the Murphy's test. The Rothstein's is an inspection of the peritoneal irritation due to the appendix or appendicitis. Now I also have to check for rebound pain. Can you tell me if there's any pain or tenderness when I press? Was there any pain or tenderness when I released? That's checking for rebound pain. I've palpated the spleen. I have palpated femoral, and I need to palpate the aorta, which is average 3 centimeters on an adult, but since he's only 11, it would be considerably smaller. Light palpations of the abdomen is 1 to 2 centimeters deep. You press and roll to all 4 quadrants. And then deep palpations is 1 to 2 inches deep. Again, all 4 quadrants. Any pain or tenderness? Okay. And that is my abdominal assessment.